My name is Cathy Ridd and I care for my husband Andy, who has motor neurone disease, MND. It's interesting, we've heard a lot from previous presenters about people not taking responsibility for their own health and the consequences of that. Whereas MND, on the other hand, seems particularly to hit people who are extremely fit and otherwise very healthy. You may know that MND has no treatment really, there is no cure. Doctors can't even give you an accurate prediction of how the disease is going to progress, but there is an average life expectancy of 27 months from diagnosis. In the absence of any treatment or cure, what we need from our health service is good management of the many and complex health issues which arise as MND progresses and takes its toll. And I'm sorry to say that this is where our health service often fails us. I need to emphasise it's not the individuals in the health service, it's the system itself. The problem starts at diagnosis. It took 11 months for Andy to be diagnosed. Would it have mattered if he was diagnosed earlier? Well, in the absence of a cure, that doesn't make any difference, but there is one drug which sometimes has an effect on MND and can keep you in the early stages for longer. By the time Andy was diagnosed in November last year, he'd already passed that early stage. It was too late. Talking to other MND carers, I'm part of an Australia-wide forum, long delays in diagnosis are very common. The UK has introduced a protocol for GPs to help them. It's a really simple tool called MND Red Flags. Unbelievably simple, but very effective, and we need something like that in Australia. As Andy's condition deteriorates, we have more need of palliative care services. And that's to give him the best quality of life now and the right care so that he can die well. We've had a very bad experience with this locally so far, partly because GPs often don't understand palliative care. That's not their job. But they're having to cover because we have only one palliative care specialist in town, and due to funding cuts, he works part-time. Andy is a courageous and gracious man, but he is sometimes, he's sometimes overwhelmed with fear that he's going to die in pain and in hospital rather than peacefully at home because the right services aren't available. He's now totally reliant on a motorised wheelchair, and we have a borrowed chair which isn't customised for Andy's needs, and it causes him a lot of pain, apart from having a number of mechanical issues. We applied to the state government for funding for a customised chair back in February as soon as we could. But due to the prioritisation criteria, at the earliest, we will get that chair next March. Our reality is that by next March, Andy won't need a chair anymore. We also had to wait 7 months for our care package funding, and that funding pays for carers to come in a couple of hours a day to help me. That's how I can be here today. And it also pays for some equipment and aids. At least we live in New South Wales where funding is available, because this is the cruelest and for me the most unbelievable aspect of our health service, is if you live in the wrong state or territory, there is virtually no funding. Queensland seems to be the worst, though it's not much better in the ACT, where they're actually, ironically, piloting the National Disability Insurance Scheme, but if your age group isn't part of the pilot yet, there's no funding. So what we have without funding is carers selling their assets to pay for services or trying to do it all themselves and burning out. Now, I speak today not only for Andy and myself, but on behalf of a very large number of people affected by MND around Australia. We are exhausted from battling the health system to try to get what we need when we need it. The system of prioritising people's needs doesn't take into account conditions which degenerate rapidly. And that's not just my opinion. I've heard that from healthcare professionals, and I've heard that from the funding bodies themselves. They all admit that's the case. Even more than that, people with life-limiting conditions should not be the victim of a postcode lottery. It is a disgrace that not all Australians have equal access to funding and services. So what we ask for is faster diagnosis. We ask for properly funded palliative care services, but above all, we ask for equitable and timely funding. It's quite simply unacceptable that the quality and level of health care you receive depends on which state you live in. I promised Andy I'd do everything in my power to make sure that he lives and dies with dignity, and it's what every person with MND deserves, and that's why I'm paying you today. So, thank you.
Thank you very much, Ms. Ridd, for your